In today's episode of the podcast, we're going to be talking about the role your hips play in recovering from lower back pain, the way in which they can block things, the way in which they can help things, and also just generally lower back health for the long term, how hips or good hip health in your hips can really be a boon to your back health, back resilience, so that you can avoid episodes of back pain. And I think it's worth starting out. Oftentimes, those that come into the clinic that we've seen as members that have persistent, long-standing lower back pain have some element of issue in the hips, and we'll explore that today. But what's quite interesting is we don't tend to see people that don't have those issues with the hips, those weaknesses in the hips, those incompetencies in the hips, because most of the time, those are the people that get a little bit of back pain and they recover very, very quickly from it because the hips are able to take up their role while that lower back is feeling vulnerable, while that lower back's maybe got a bit of an injury in it, and then carry on and allow for the effective healing processes to take place. So I think it's a good place to start out. It's why too many of us have weakness in our hips. And quite frankly, it's because we just don't use them effectively. So many of us are sedentary for extended periods of the day. We don't partake in the appropriate exercise regime to build strength in the hips. And that's not just being able to stand or walk for a set distance. That's being able to move fully through those hips and have competence. And we see ripples of this weakness here in issues with the knees, issues with the ankles, the feet, etc., and obviously the lower back. So it's an area that too many of us just do not devote the time, effort, and energy to improving the competence of this particular area. And as a result of that, they're weaker. And then when things do arise in terms of problems, issues, lower back, etc., we really do struggle. So I think it's first helpful to just explore a little bit about the degenerative side of the hips. And what I mean by this is it doesn't have to be raging arthritis, fusion of the joint. It can be the slow degradation of health in our hip joints. And too often people get really caught up on the bony aspect of this, the bony spurs that have developed. You see them on the x-ray or they've been identified on MRI. And you see, oh gosh, that arthritic joint, you have arthritis in the joint. But what is this? We have to understand that yes, you see the health of the bone, you see the changes in the bone, but chances are that that bony change has been there long before you had the pain. So that's one thing to bear in mind. Secondarily, is you're not considering at all the woefully inadequate health of the soft tissues around there. We're talking the joint capsule, we're talking the tendons, we're talking the muscles themselves, the ligaments, etc. That's the hip joint in itself. When people think about the arthritis, they think just of the bone and maybe the cartilage being worn down, but pay little attention to the tissues that most likely are causing most of your pain, and that is or that are responsible for the flare-ups that you have, the aggravations and the quote-unquote injuries that you have around that arthritic joint. It is that the joint itself is less healthy, and all of the factors that maintain the health of that joint are less healthy. Now, we can't necessarily shave off bits of bone as easily or in a non-invasive way, but we can make tremendous inroads into the health of that joint if we start moving forwards. And that's some of the stuff that we'll be talking about towards the end of the episode of the podcast. But we think about issues like hamstring tendonitis, like glute tendonitis, like greater trochanteric bursitis. A lot of people struggle with these issues co-occurring with lower back issues, and we see that deep synergy between the health of the lower back and the hips in that. But they have these issues and they don't think, okay, actually that's part of the degenerative component of my hips. My hips are not just a joint. My hips is a region of the body. Then we really need to consider all of those muscles, not just the glutes, but the hip flexors. You've got the adductors, etc. All of those muscles working in synergy to promote good health in that joint. And in order to maintain good health in that joint, the joint has to be used through a full range of motion. It needs to have load applied to it in those full ranges of motion to appropriately stimulate the joint itself, the synovial fluid secretion, the adequate bathing of that joint. What often happens when we have degenerative joints is that we start off with a full range of motion when we're young, and as we lose the health of the joint itself, it slowly says you can move less, and you start to find the very ends of the spectrum, both flexion and extension or internal and external rotation, start to become uncomfortable. So we don't go to those ranges anymore. So we lose a little bit more of that range of motion. Then we play in this space, and then that the missing part of range of motion, those areas now on the peripheries, they don't get used very often. So the health of those areas of the joints start to degrade, and then we lose more and more and more. And the muscles having to operate within those particular ranges of motion do not get exposed in that same way because we're not using that range of motion. So it becomes weaker and weaker and weaker. And when you think about it, this is kind of a a natural and understandable process. For example, I use the example quite often. If you were to go ice skating, you'd be very stiff, you'd be very rigid. You wouldn't move a lot the first time you were learning to ice skate because you've got a lot of mobility and you try and limit the amount of mobility that could possibly take place on this uneven surface. But as you get more competent, as you get stronger, as you get more effective at the ice skating, you're more free to flow and move around on the ice or on the roller skates, whatever it may be. And you can move more effortlessly. You're more happy to deal with that excess range of motion, with that excess mobility. And that's what we see in the hips, the reverse of that taking place. We've got less competence and therefore we gradually limit and limit and limit to the point where we can't move at all. Now, there are two key movements or motions at the hips that we need to bear in mind. The first one is going to be flexion, and then the opposition is extension. So a full flexion movement might be you bringing your knees towards your chest, or being sat in the office chair all day with the hip at 90 degrees, the knees too. And what happens here is when we're in this flexion position, and this is normal, completely normal, the hip kind of decompresses a little bit. There's a little bit more room for movement. In that decompression that's taking place, that relative decompression, because it's only slight, it's to allow for more mobility. Now we can think that makes sense because we're unlikely when our hip is at 90 degrees to be required to bear a lot of load, to be required to have the weight of our body on us in the same sort of way as when we're standing upright. And therefore, we're also likely to require a little bit more mobility. Maybe we need a bit more external rotation. Maybe we need some other ranges of motion to help us effectively use our hips. So we have a little bit more mobility in the flexion. But when we go over to the extension position, that's the standing upright, we find that we lose a degree of mobility, and that is traded off for a degree of stability as the hip ball and socket screws in tightly and provides those strong contact points for the effective transmission of force up and down or through that hip joint up and down the body, because it is most likely that we're going to have to carry something or move or have our whole body weight going through that hip joint. The stability there is something that is wanted and is naturally kind of designed or baked into the process. Now, if we think about that from a point of view of the degenerative process, one of the first movements or ranges of motion that we tend to lose as the hips become degenerative is going to be that extension, that full screwing in of the hip joint as we go and stand up straight. And we can all relate to someone, an older family member or a contemporary who has some hip issues, and whenever they stand up straight, they're not actually straight, they're slightly bent forwards. Now, what role does that have for the lower back? What it means is that when they stand up straight, irrespective of whether they have any current back issues or back injuries, they're leaning slightly forward. By definition, we've understood that if their hips are degenerate, the muscles around that area are also likely to be degenerative too, and therefore not as strong as they should be. But now with that slight forward pitch to the body, we're going to find we have more load going through the spine, going through the body, going through the hips and going through the muscles that is going to be we're going to have to negotiate. We're going to have to account for that in our sort of mechanical system. So that's the first thing. And what happens when we then have an injury? If we can't even stand up straight, we're always in a circumstance or in a situation where we're leaning slightly forward, putting more load through that lower back that happens to be injured. So that's something really worth bearing in mind as you move forwards. If we are thinking about having degeneration in the hips and that standing posture and the implication that has on the lower back. But fundamentally, the reason that your hips are so important for your lower back health, whether or not you have an injury, is because good functioning hips are a very strong and stable ball and socket joint through all ranges of motion. Yes, you're going to be weaker if you're in a deep squat than you are when you're stood up straight. For example, you might be able to pick up some weight off a squat rack and hold it just in a standing position, a significant amount of weight greater than if you were to sit down into a sort of a squatted position and hold the same weight. You just wouldn't be able to manage. So we are going to be stronger in certain ranges of motion, but the joint itself is strong in all ranges of motion because of its sort of very deep set arrangement. When we think of the lower back, however, you've just got a bunch of blocks stacked on top of one another. And those blocks are maintained by ligament integrity that holds the alignment of the lumbar spine. It's the strength of the ligaments running through that lumbar spine that hold it in its set position. And then overlaid that, the whole thing is held and supported by the musculature around the trunk region. There are also significant influences from the glutes and from the lats higher up as well to provide stability and supporting struts in that section of the lumbar spine, but we won't go into that detail today. The point remains that the lower back fundamentally itself, in different ranges of motion, side bending, rotation, forward bending, etc., is not as competent as the hip joint. And therefore, if we have strong, healthy, mobile hips, the hips can take up the lion's share of movement that is required on a daily basis. So, for example, if you're going down to pick a sock up off the floor, then you can bend down with your hips and knees in a healthy way so that your lower back doesn't have to crane over. And maybe your lower back is involved in the very last part of movement, a slight forward bend. Therefore, preserving the integrity, relatively speaking, of the lower back by the hips taking up that load. But what we see is the contrast in so many people is that their hips just stop partaking in movement. Not really because they're painful in the early days, but they just use their lower back instead out of perhaps laziness because the muscles are actually weaker. So it's quite a lot of effort to go all the way down there and come back up. And that, I think, partially is a result of maybe culture. And in Western cultures, we tend to not incorporate things like floor beds and just cultural habits of squatting down like maybe a child would. That in other cultures, that's kept through into adult years. And it's just perfectly normal to see adults, maybe even people that might be a little bit older than we would think, just squatting down there, having a conversation or whatever it may be. We don't tend to see that in Western cultures. It's lost really from the point at which you go to school. You all of a sudden you start sitting on chairs and losing that deep squatting ability, so that it's a lot of effort to get down there. So you stop doing it. So you start rounding your lower back over, and then we wonder why that's a problem when we consider the fact that everybody sits down all day, etc., etc., etc. So going off on a bit of a tangent there, but hopefully that makes sense. Now, what role does it have what role do the hips have in recovering from lower back? Well, it's the same thing. If you have an injury now in your lower back, when your back does round over and crane over, one of those segments is going to move a little bit more than the others because it's injured, because it's got some damage to the ligaments, the discs, etc. Maybe it's got something more going on. Maybe there's a spondylolisthesis where the vertebra is actually shifted and it's very unstable. We have a number of different things going on. But the fundamental truth is that the more that lower back has to partake in movement on a day-to-day basis of large amplitude, so large ranges of motion going all the way over and back, the more it has to do that, the more it's going to be provoked, the more it's going to be compromised, the more it's going to be flared up. If we have strong hips, however, the amount of movement that lower back has to do while it's injured and while it's going to be fundamentally quite dysfunctional in its movement because it hasn't had a chance to heal up and restore integrity, the better our hips can partake of the general movements and the less our lower back has to be involved, the better we're going to do. The more quickly we're going to start to get resolution and healing taking place and shoring up of the integrity of the lower back, so that it can start to become a strong, stable structure itself again and go through the necessary healing process. Now, when it comes to strengthening up the hips, there are lots of different approaches. There are lots of different ways to do this, but we try and make things as simple as possible. And understanding how to move forwards is really quite important, and it is not complex at all. But you'll often see, your glutes a week, this week, that week, etc. And one of the exercises that is commonly prescribed is going to be bridges. And we have to understand that the bridge is basically done lying on the floor with next to no body weight. Now, if you're someone who's able to get out of the chair 10 times, let's say, and you maybe went to the office to see your chiropractor, your osteopath, your GP, your doctor, whoever it is, and they've said, oh, you need to strengthen your hips, you need to use bridges, and that's all you're doing as part of your strengthening regime. If you can already do 10 squats, 10 bridges are not going to challenge you. They're just not going to challenge you in the same way. Now, if it's 10 bridges adding weight on, etc., 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 then that's a separate story. But all too often we get people, or we've had patients over the years and members in the program, they've been told, you've got to do these 10 bridges, 10 bridges 3 times a day or something like that. And then they're expected to strengthen the hips, and it's not how it works. Now, granted, if you've just come out of surgery and you're rehabilitating from the ground up, then yes, bridges are going to be a factor. But if you're already able to do 10 squats, which requires this much competence of your hips, and you're doing bridges down here, you're never going to get anything stronger because it's not a high enough level or high enough order activity or exercise to stimulate the strengthening response in your body. So you have to be working at the appropriate intensity. So that's one big mistake. Not that bridges are bad, but quite often bridges are given to people that can do way more than that. And it's just seen as, oh, well, it's a safe exercise, you can do it on the floor. But it's a safe exercise, it's going to basically get you nowhere. It's just a practice. It's not a strengthening exercise. It's not adhering to fundamental strengthening principles, if you will. It's not going to do anything. So that's critically important. Now, our personal favorites of these exercises, or the exercises to strengthen your hips, you're going to be the squat, the hip hinge, and then the split squat or reverse lunge. Because the latter one is a little bit more complex, needs a little bit more balance. It's going to focus on one leg versus the other. And then the former two we can all do because we're already doing them every single day. And you can do them with a very, very limited range of motion, hardly bending at all, hardly moving at all if you're very, very weak. And you can scale that all the way to lifting 100 pounds, 200 pounds, 300 pounds on some of these movements, or appropriate translation to kilos, 50 kilos, 60 kilos, 100 kilos or more. Not saying you have to, but those exercises are so simple that you can strengthen your glutes, your hips, and all the muscles around there with those exercises. And they're an exercise that you can focus on getting good at, and particularly the squat and the hip hinge, that you're doing every single day anyway, when you brush your teeth, when you do the washing up, when you get out of a chair, when you get off the toilet seat, when you go up the stairs, in the case of the lunge or the split squat, you're doing these exercises anyway. So learning to do them effectively has huge immediate benefits in that you will learn to start moving properly on a daily basis in a safer way for your back and for your and a more effective way for your hips. But also you can scale the intensity, the difficulty of those exercises up or down according to your current and future strength levels. So they make them hugely effective, because the simple truth with any exercise selection is if you've got like 15 to 20 different exercises that you're supposed to be doing, the chances are it's going to take you a significant amount of time to learn to do them competently enough to start to experiment with the resistance, to work out at the appropriate intensity, to then start doing it for 6 weeks to get some improvements. So it's so much easier if you just keep things simple. Unfortunately, it's not particularly glamorous, but it does really work for most of us. Now, yes, there are some bodybuilders and there are some elite level athletes that need different tools. They need extra help. They need extra specific guidance to break through certain plateaus. But most of you watching this, most of our audience, our viewers on YouTube and our members are not those breaking Olympic records. They're ordinary people just like you and me. Maybe some like working out a little bit more than others. But they're in a bit of trouble and need to get out of that. They don't need fancy, very peculiar different strategies. You just need to do the basics consistently. And you need to do them over time. You need to do them well. You need to do them at the appropriate intensity. So we'll close out here, whether it's a split squat, whether it's the squat, whether it's the hip hinge. We've got a few little step-by-steps which I've written down here, which I'll go through with you guys to help make sure you can get into these exercises. Strengthen your hips, whether you've got a bad back right now or you don't. They're going to be helpful for your hip health and for your back health for the long term. The very first thing is focus on these on your core engagement and your posture engagement. That means that you've got good, nice, upright posture. You're doing a bit of a chest pop, your core muscles engaged, your back muscles are engaged, everything's nice and braced. Your lower back should not be partaking in this movement. Now, just as a quick side, you will see some full, deep sort of Asian squat style movements where people are squatting all the way down and the back is rounding. When you have a back problem, that is not appropriate. And you need to understand and appreciate and learn to identify when your body actually does that movement, because it's probably doing it every day. And that's where, if you can learn to brace and engage your core and postural muscles, you'll start to feel when your back wants to unlock, so to speak, and round a little bit, and stop that from happening when you're learning. There's other stuff in the future, long into the future, where you can talk about reintroducing those sorts of things, but not now and not for the foreseeable. Focus on getting your core engaged and focus on those postural muscles too, to make sure that your upper body above the hips doesn't move. It's like a drawbridge. Second thing, keep your knees in mind. Most of us that have weakness in the hips are going to find that when we are tested on these three movements, particularly the squat and the reverse lunge or split squat, not so much the hip hinge, that your knees will fall in. And that's because your glutes in particular are not holding them in the right position. There may be a bit of arch issues as well there. But make sure that you're bearing your knees in mind. A great way to do this is either record your exercises from the front or do them in front of a mirror to make sure that your knees don't roll in as you're going down through the movement. That is a classic error. And if you do find that's happening and you're like, oh, my knees hurt or I've got knee issues, well, that's probably why. So you're in the right place, but you've got to make sure that the knees don't move. So correct technique is important. It doesn't matter where you start, which brings me to the next point, which is focus on a pain-free, well choreographed range of motion to begin with. That means if you can only bend, if this is your knee joint here, if you can only bend a little bit, you only do a slight movement, go down, 6 inches or so, then that's fine. That's where you're starting. If you can go all the way down to 90 degrees and that's where you're starting, and you keep your spine nice and neutral and everyththing's good, and you've got good, well choreographed squat or hip hinge or split squat, then great, that's where you start. It doesn't really matter. But know that you have to start from a pain-free point. So you can scale that backwards or you can scale that up. That's entirely up to you. That's why these exercises are so great and so accessible to absolutely everyone, because the simple fact of the matter is, even as bad as you might feel your hip is, or your lower back is, you probably got into a car and drove or were driven to the hospital, to the doctor, to sit in the surgeon's office, to sit in the waiting room, to get out of the chair, to get back into the chair, to get out of the chair, to get back into the chair, and then go all the way home. So you probably were still able to do some version of a squat, so you may as well be doing this. But you learn to do what is the pain-free squat. And the surgeon, at the same time, even if it was a very bad case, was perfectly happy for you to go through all of those things in the process of coming in and going home. And we discussed this in particular on a previous podcast referencing surgery. So you can always check that particular episode. I can't remember which one it is off the top of my head, but you can check that one out if you are someone who does have a little bit more severe case of back pain and you're looking at the prospects of things like surgery. So then we get on to, once we've got the technique mastered, it's our opportunity to work hard. And that really is about us scaling with weights. That's saying, right, I'm going to start to add on, maybe using some resistance bands, maybe using some kettlebells, maybe using some dumbbells to hold, to add a bit of resistance. Now you could use things around the house, cartons of milk. You could use bags of sugar if you're starting out from a very low level, and you just steadily increase the weights over time. And then the final one is working this interplay between increasing the ranges of motion that you're using. So that means going a little bit deeper, making sure again that your technique is all correct, the knees aren't wobbling, etc., the back's not rounding. And then also increasing the weight further. So you might say, for example, for the next 4 weeks, you're going to work on the set weight that you're using. Let's say it was 15 kilos, for example, on a hip hinge. And you might be doing your 5 sets of 10 or something like that. And you're just using that new weight. And then for the next 4 weeks, you might really spend a bit of time to focus on going a little bit lower, because as you go lower, different muscles start to kick in different ways and different weaknesses get exposed. And you want to make sure that you're able to do that. The additional advantage if you have a lower back pain or lower back injury, if you have lower back pain or a lower back injury, of doing that sort of dual approach where you increase the weight for 4 to 6 weeks, something like that. And then, so you take the weight up and then you stick on that new weight for 4 to 6 weeks. Then keeping that same weight, work on going a little bit deeper for another couple of weeks, maybe 3, 4, 5, 6 weeks, depending on your experience with that, is that you give your spine longer at the same weight to build a tolerance, build adaptation for that weight. One of the big challenges that a lot of the more active people face, maybe the younger crowd, we could say, is that they maybe like doing a bit of working out, they've injured their back, they're getting back into these sorts of exercises, they're getting back into the gym maybe, and they push the weights too far too fast. Why? Because the muscles of the hips will get stronger much, much faster than the healing that's taking place in the spinal discs, let's say, at L5S1, or in the segments supporting structures, the ligaments, etc., in the lumbar spine. So by having this artificially manufactured in pause, where we work a slightly different component, range of motion, for example, at a deeper range, working different muscles without needing to increase the weight, can just give our spine time to chance to catch up to the change that's taking place in the muscle. So that's a nice little strategy for those of you that are a little bit more inclined to do sort of fitness and working out. So that's it. That's pretty much it. We've got focus on your core engagement. Make sure that your knees, they're a good track for whether, a good indicator for whether you're losing the composure in the muscles of your hips. Focus on that pain-free range of motion. Get your technique mastered first before you start working hard. So that's the above points. Scale with weights and have an interplay with the weights and the range of motion as you steadily, over the months and years, work on decreasing the range of motion, going deeper on the range of motion of these movements. The hip hinge going over further as your hamstrings start to free up. The squat going deeper as the range of muscles start to allow you to go deeper and your competence improves, your balance improves, and the same thing for the split squat. And that's your pathway forward for months and years, because quite frankly, most of you that have degenerative change in the hips, unhealthy hips, it's been years or decades in the making, and it's going to take some time to improve those things. But consistency is the most important thing. And what have you got to lose? Working on this for the long term is only going to be a boon to your health, especially as you start to get into it, start to do what we would say, quote unquote, harder sessions. You're going to have a myriad of other health benefits associated with this, not just the health of your hips, the health of your back, but your cardiovascular system, your lungs, your heart, your mood, your etc. Loads of different things from doing these things consistently over the long term. I hope this episode of the podcast on hips has been helpful for you. If you do have any questions about your specific hips or any other topics you'd like us to cover on the podcast, remember, you can always use that comment section below. Give us a thumbs up if you did find this helpful. Consider subscribing to the channel. We release a new episode every single week, and we will see you in the next episode of the podcast. Thank you for watching.